Hi, Anvin.
Hi,
It's a
Shailja.
pleasure to have you here.
Thank you.
Great. Can you give us a 1 minute elevator pitch on what you guys are building?
Sure. So we are working for US healthcare providers to help them improve their revenues and billing accuracy. For US healthcare, claims are very important, right? If claims are not done properly, they risk losing billions of dollars in delayed payments and
Yeah.
lost revenue. And they're under pressure because of increased claims scrutiny by payers. So we help them to autonomously create claims, also improve the claim accuracy and reduce denials. Today, humans do a lot of this work,
Yeah.
and it's difficult to find staff in the US to staff the administrative teams. Uh, they also need to be trained, retained. There's a lot of attrition,
Right.
and so, with technology, we are able to do things faster and at scale, which is probably difficult in the US with, people in the teams.
Hmm.
In addition, because of the advantages of Gen AI, which, we are all aware about, we are able to increase the accuracy of the claims.
Yeah.
We are also able to, for example, provide explanation for every code that we choose in the
Yeah.
claim, which helps in increasing transparency. It also helps during audits and claim appeals. So,
Yeah.
in a way, it's a win win for everyone involved. One of our key targets is also the workforce in hospitals, whom we believe are our partners,
Yeah.
to ensure that, the claims are processed efficiently from the healthcare provider perspective.
Got it. That's very interesting. But I think that brings me to a very important question that I think all of us would think about. In the ecosystem, we've all known that medical coding is broken.
Yeah.
But what made you think that AI would be the way to solve for it? And it's not just automating some aspects of it.
Sure, it's a great question. In fact, when we started out back in 2024, um, we were not sure how much AI can actually be applicable to this space.
Hmm.
We knew this was a hard classification problem in the traditional
Yeah.
AI sense. And my co founder, Kamal, who's leading the technology part, had some experience doing this.
Hmm.
And when we identified this area, we said, okay, it's a classification problem. And in the past, rules based engines and NLP approaches had not really succeeded in automating it the way it was
Yeah.
intended to. So, we took it on like that. And what we realized is it's a hard classification problem, but there are some generic advantages due to the nature of LLMs
Yeah.
that helps us approach this in a completely different way. Like I mentioned to you, we are able to sort of look through this wide space of potential codes,
Yeah.
the ICD codes, which are the diagnosis
Yeah.
codes, and the CPT codes, which are the procedure codes, more efficiently and provide better semantic results than
Hmm.
previous approaches. We are also able to explain the results for a human reviewer or for a later audit purpose. And along the way, we realize that there are a lot of guidelines that humans refer to today,
Hmm.
human staff refer to today, which the technology is able to refer to more comprehensively because these guidelines run into hundreds of pages. I mean, it's not humanly possible
Right.
on a daily basis to do everything correctly.
Yeah.
So we understood that there are some inherent advantages to AI because it's able to do it more consistently
Hmm.
day by day, right?
Makes sense. I'm just curious to understand that, with anything that you're building in healthcare, data is very, very sacrosanct in that sense. There is HIPAA compliance, SOU compliance that you need to follow. So when you're starting to work with hospitals and clinics, how do they trust you with their live clinical notes or patient data? And many a times the trust comes with being around for many, many years, like many legacy players have been. But to collect that data, you still need a lot more projects to work on. So, how do you solve for that chicken and egg problem?
You nailed it. It's a chicken and egg problem. And especially in healthcare, working with clinical data is a huge responsibility.
Yeah.
And there are standard certifications like HIPAA and SOC 2, which are kind of table stakes,
Hmm.
even for a startup, right? That gives a little bit of, uh, it's not easy being a startup in health
Yeah.
tech, like you said. We are getting all those certifications in place. But I also think what's helping us is the fact that a lot of healthcare providers we speak to are equally excited about AI.
Right.
Uh, they are suffering, like I mentioned before, with administrative burden and loss of revenues.
Hmm.
And clearly, there is, in this particular case, AI has a great monetary advantage for them. And
Right.
so they're open to trying us out. But we do know that there are some things in any startup's playbook which I think can help mitigate large enterprise customers' lack of trust, if I may
Hmm.
say so.
Yeah.
So we are actively looking to partner with, other technology providers and service providers who may
Hmm.
already be working with that hospital
Right.
to sort of help us get into that data. Uh,
Hmm.
and also, as a company, we believe that irrespective of the healthcare bit, uh, we should make it easier for customers to trust us. So we are offering a outcome-based pricing and free evaluation. So it's really easy for them to try us out, understand our security posture, and then take a call about engaging with us at the long haul.
Got it. No, makes a lot of sense. I think those partnerships can also open a lot more doors for you guys.
We hope so.
Right. I think we would also love to understand that, when you're speaking with investors who are not specialists in healthcare or non healthcare investor, what are the most common questions that you get from them? And how do you help them understand that it's a problem which is a lot more complicated than it may seem on the surface?
It's almost a hidden fact for many non-healthcare folks that there is such a huge piece of administrative machinery behind a hospital.
Hmm.
So when we think about technology and AI in medical field, there's a lot of clinical AI that helps to diagnose and so on for doctors.
Hmm.
uh, it's such a huge initiative from the hospital side and even on the payer side to manage the administrative machinery of submitting claims,
Right.
uh, not just claims, even hiring people and all that operational stuff is a big part of healthcare, which
Hmm.
is usually behind the scenes.
Yeah.
It's the back office,
Hmm.
just the revenue cycle management, which is the
Hmm.
term for submitting claims and getting it approved, is a 200 billion market, right?
Right.
Of the 5 trillion US healthcare market. So it's a big market. And
Hmm.
when people hear that market size,
Yeah.
they're surprised. A lot of that is technology, but a lot of that is also outsourced. 20 billion of that is technology, but 90% of that is still staff in
Hmm.
house and outsourced and a services market.
Yeah.
And so I think one of the things that we are doing as an AI company is reimagining how AI
Hmm.
can help. And we believe that it's not just technology. AI is a little bit more intelligent than the technology we have known so far.
Yeah.
So I think what we are addressing is really this entire 200 billion market, which includes services, right? We want to
Hmm.
own the outcomes of actually submitting a claim and
Right.
not just provide a software which
Hmm.
can act transactionally. So I
Makes
think
sense.
these are some of the things that we have to explain a little bit to non-healthcare investors.
Fair enough. I think this was a very insightful conversation. Thank you so much for taking out the time.
Thanks a lot, Shailja.